So I get asked from time to time, can any doctor remove my mesh? And it's really important to understand that just because you have mesh doesn't mean it needs to be removed. Many times mesh has been moved properly and safely when placed by the appropriate route, by the appropriate kind of surgeon to solve a very specific quality of life or life-threatening issue for a patient. Many times mesh placed abdominally for hernia repairs, for example, and certain kinds of abdominally placed mesh for prolapse repair are designed to improve a quality of life situation that had worsened. Different types of mesh placement, for example, transvaginal mesh for prolapse repair, tends to be associated with a higher density of problems post-mesh placement. So if you're feeling that you have a new onset complaint, symptom, leakage, bleeding, pain with intercourse, and you're really clear that that symptom did not exist before your mesh placement, it's important to get evaluated by an appropriately trained, fellowship-trained urogynecologist or specially trained urologist or even colorectal surgeon to determine what the contribution of the mesh is to your problem. So if you've had mesh placed, you've had a new onset of symptoms after your transvaginal mesh placement, and you find an appropriately trained physician, surgeon, who can listen carefully to you, who can examine you and determine that the mesh is associated with the problem that you're describing, the pain, the bleeding, urinary leakage, inability to have bowel movements or whatever, then the question then becomes, will removal of the mesh solve your clinical problem? Many times, that is the case, that removal of the mesh by a competent, well-trained, usually fellowship-trained urogynecologist or urologist will help improve your pelvic floor symptoms that can be attributed to the mesh itself. If that's the case, then the mesh needs to be removed by someone with lots of experience removing mesh. Certain kinds of synthetic meshes can be removed relatively safely by appropriately trained pelvic surgeons with lots of experience and lots of ability to handle potential complications. If that is the case and the mesh is removed, many of my patients will ask, hey, will my symptoms return? Well, if you had the mesh placed for prolapse and it cured your prolapse and then you remove the mesh, there's a good chance your prolapse will come back. And if your prolapse is coming back, many women would say, nah, I don't want any more mesh in me. And in fact, what we've done, and we've developed techniques here at Pelvic Floor Institute for using your own strong tissue to replace the mesh and resuspend the vagina in a way that corrects the prolapse without creating new mesh complications. So that's something we do. Another way to think about it is if you had the mesh for incontinence or urinary incontinence, and certain types of transvaginally placed mesh for urinary incontinence can also misbehave. If that's the case, and that mesh is explanted and your incontinence returns, then understand that there will be a technique that's available that's mesh-free that can be used to address your urinary incontinence as well. The only surgeon you should allow to remove your mesh if it's determined to be the cause of your new onset symptoms, which occurred after the mesh placement, the only correct surgeon that can do that is someone who's fellowship-trained urogynecologist, colorectal surgeon, pelvic surgeon, who has lots of experience removing lots and lots of mesh. That's your best bet. I think many women who feel like they have a situation of pain developing after their mesh surgery, most of those women will return to the implanting surgeon, and often those implanting surgeons will offer to correct the problem. In the cases where the implanting surgeon doesn't feel confident or capable of addressing the new complaints, that patient will then be obliged to go to someone who specializes in the treatment of complications related to mesh implantations.